We'll start with introductions. I'm Pat Malone, Commissioner. Joe Curtis.
Rash, Public Information Officer.
And
Annabelle Jaramillo, Commissioner.
Greg Riddler, Sheriff's Office.
Danielle Brown, Health Department.
Charlie Fountain, Health Department. Georgia Linney, Public Works.
Teresa Farley, Board of Commissioners.
Don Rogers, Sheriff's Office.
Erica Milo, Board Reporter.
And it looks like we have a couple people, citizens calling in. See Mike Beilstein. Are you there, Mike?
Yeah, hello.
Good
Happy
morning.
to be here.
And John Sarna.
John Sarna, Member of the Public.
Okay, welcome. And Bennett Hall.
Yeah, hi, Pat.
Morning, Bennett. All right. Are there any announcements? Hearing or seeing none. Comments from the public? All right. Item 3, review and approve the agenda. Are there any additions or corrections? Hearing none. Item 4, chair decisions. There have been no decisions from the chair since our last meeting. Moving right along. Item 5, work session 5.1, update from the EOC. We have Charlie.
Good morning, everybody. Dave Busby called in here.
Oh, morning, Dave. I was going to stall till I saw you, but I understood you were going to report from the EOC, and then Charlie Fountain and Danielle Brown.
Yeah.
And George Loon.
Yeah, I'm sure. I think Charlie's on the call as well. But from an EOC standpoint, we are working virtual and learning some of the challenges. Our GoToMeeting minute this morning didn't work too well, so we'll fix that by Thursday. We are meeting every Tuesday and Thursday and then collaborating via email and text otherwise. And as Charlie will talk about, Brian and I are on a collaboration call with him every Monday and Wednesday. So there's still a lot of coordination going on between public health, between economic development, and the emergency management system. This week, we are kind of focused on building a plan for mask distribution. And there's two things that happen along the mask front. Last week in an OEM call, Brian was notified that we are getting 11,000 masks that are supposed to be delivered throughout the county to businesses with less than 50 employees. And the state figured out the number of 11,000, don't know what rubric they figured that with, but they did. And so we're meeting tomorrow afternoon to talk with Cape Force Economic Development and Recovery and kind of at least outline some plans for that. And then the second part of that is we have masks that we want to do a community-wide distribution with. And so we're working out all of the locations, the logistics that would go along with those locations, the staffing for distribution, and basically set up a good date and location throughout Benton County so that we can distribute masks to the community. So we're working that plan as well and trying to put some nuts and bolts on that. That would obviously take a huge JIC push to get both media and social media on the same page so that we get the communities engaged. And we're also working with public health and making sure all of the relationships that they have with the different organizations throughout the community, we support those and work with those and use them as kind of sponsors for those distribution sites. So that's a big one. We get daily reports from the county on the numbers of COVID positive cases that we see in the county. And I don't know if you guys are copied on that. I assume you are. But one of the disturbing trends is the age group is shifting down here in Benton County. So we had, as of 9 o'clock yesterday, there was one case where the age group was 50 to 59. The other 5 were 20 to 29. And so I think that kind of reinforces a behavioral message for the community in that, you know, age is no longer a determining factor, and the numbers nationwide continue to grow in the younger population. And so we need to reinforce the message of masks and all of those kinds of things that, you know, social and physical distancing works, masks work, and continue to push that message for all age groups. And there's nobody that's really not at risk now. We're seeing that trend in the numbers nationwide. And then the last thing I wanted to mention was that City Council met last night and approved a proclamation enforcing the use of masks, or strongly recommending the use of masks. And they also kind of had a caveat with that, which they were going to relook at that in the near future to see if they needed stronger language to reinforce the use of masks. So that's kind of a good news story. They did mirror a lot of the language that the county used, so we're on very similar messages to the community. And pending any questions, that's really all I had to bring up, unless you have questions for me.
Pat, this is Annabelle. I do have a question. Can you hear me?
Yes.
Yes, ma'am.
Okay. The question has to do with some of our rural communities. Are we going to plan any mass distributions in Monroe, for example, or Alsea, or other
Yes.
small areas?
Yes, definitely. We have listed, and again, it works with the public health and the relationships that we've already built. I have about a half dozen Adair, Monroe, Philomath, that are outside the city of Corvallis. So it is county-wide, and that's where the logistics of this thing becomes a bit of a challenge. We are kind of copying Lincoln County's plan as far as how they did this with their communities, so we're not going from scratch here. But yeah, definitely county-wide, and it will be offered to a wide audience.
I have a follow-up, if possible. What about sensitive communities like farm workers?
Yes, and we actually have, and it's already on order through the state, but we have masks coming. They are more usable than what the state tried to give us in the past. And so Brian had made that order about 3 weeks ago, and we're waiting on state delivery of those masks. And we'll work with public health representatives and make sure that they get to the right areas of the community, because they already have those relationships.
Absolutely. Thank you.
You're welcome.
So, Dave, it sounds like, as far as masks, the supply is catching up to the demand. Are there any other PPEs that are there any that are in short supply at this point?
Yeah, the last discussion I had with Brian on this, the gowns, we have a pile of gowns, but the burn rate, once the hospital starts going through a large amount of cases, they really use a lot of gowns, and I think that also includes like our long-term care facilities. So our stockpile of gowns is a little bit short. We're still getting the support from the sewing brigade on making those gowns, and they're asking for additional funding so that they can go buy some materials to make more gowns. But nationwide, I think gowns are an issue. And we've heard a lot of creative solutions, but haven't seen that in the supply chain. People are printing them. People are doing all kinds of fun things with gowns. But that would be the only one that's like an immediate concern. We have worked over the last several months, Ricky Waters and Jeff Cornwell have done a great job of making an accurate inventory of our PPE stock. So we have some pretty good numbers to make decisions on as far as distribution.
Great, thank you. Any other questions for Dave? All right, it's up to Charlie and Danielle who goes next, but it seems like it's usually Charlie, but up to you two.
Okay, I can start and just kind of build on some of what Dave said. So, yeah, we are definitely seeing a trend towards younger cases in our area. For the first about 3 months of cases here, our percentage in 20 to 30-year-olds was around 16%. And a lot of those were employees at long-term care facilities or food processing facilities, things like that. In the past 2 weeks, that percentage in 20 to 30-year-olds has gone up to 50%. And so it's a worrying trend. We're currently working a couple of clusters in social groups, and this is a trend we're seeing statewide, nationally. I was talking to my colleagues in Lane County. They're seeing the same thing associated with social gathering among younger people. It's not, we've been worried about this for a while. There's been this tendency to view this illness as primarily, if not exclusively, a risk to older people. And that younger folks had little to worry about, and a lot of the messaging out there either explicitly or implicitly reinforced that. But inevitably, with more cases, we will see more serious illness. That's just a given, particularly when this is occurring where there's already an overlay of an obesity epidemic among younger folks, and obesity is a risk factor. When we see those statistics about people being hospitalized and unfortunately perishing, having pre-existing medical conditions, we tend to think of older people in those circumstances, but we do have an epidemic of diabetes, a lot of vaping going on, a high prevalence of diabetes in younger folks, and all of those do put people at higher risk of long-term illness and poor outcomes, regardless of their age. I think one thing to remember, even though we're not seeing the very serious illness in these younger folks, this bump has really only occurred in the last couple of weeks, and oftentimes this is an illness that tends to linger and worsen over time, and so serious illness and even death are often lag diagnosis by 2, 3, 4 weeks. And so we will watch this really closely. Part of this is undoubtedly an artifact of some greater testing and greater access to people as they get routine medical encounters, being screened, being tested, and finding those asymptomatic cases. But we are seeing some pretty moderate illness, at least, in these younger folks, and really trying to follow those up very closely, and it's a worrying trend. I will note that we did have some indications in public health community yesterday that the governor is going to do some follow-up on at least on the 8 counties that were put on the watch list late last week, possibly other measures following on her statewide mask mandate. We have some indication she's going to make a media release or a statement today. Not sure when, haven't got any more details, but we will see about that because this is not just our trend, this is a statewide trend, and a number of our cases in younger people associated with these social groups are connected to people in other counties. And so these social linkages in younger people are regional and even statewide. So we are not isolated in this, and we need to build on messaging and prevention and information going statewide. I will follow up real quickly on your comment, Commissioner Jaramillo, about mask distribution and prevention messaging in rural and agricultural communities. And I just want to note, the things that Dave was talking about, the access, the penetration, the message congruence is really it would have been impossible without the long-term investment that the commissioners have supported very strongly in health navigation, in health equity, and in social determinants work. That's what's really going to come back and is coming back to pay dividends. If we were just trying to develop those sort of community connections and linkages on the fly in the middle of this, it would be incredibly challenging, and some of our sister counties around the state are doing that. We're really fortunate to already have those deep connections and be able to know who to call and set up these sort of systems pretty rapidly. So thank you for that long-term support.
I think if I add to that a little bit, Charlie, I think too that the importance of our federally qualified centers have played a big role as well.
Absolutely. Thank you for that. That's absolutely true. The credibility and the connections and just the background of overall better health in those communities is certainly a factor in much greater resilience. You're absolutely right.
All right. Any
Danielle?
other questions for Charlie? Well, thank you. Danielle.
Thank you. Good morning, Commissioners. The one thing I would add to what Charlie and Dave shared is we're still in the knee-deep in the effort of identifying additional isolation resources. We've come up against some significant brick walls and some significant barriers in finding those isolation resources for folks in Benton County. So that's work we're continuing to do remotely to try and figure out what those resources might look like and what we might utilize if and when we need it. So that's the one piece that I would add to what Charlie and Dave shared.
So we currently have an agreement in place to, I guess, through chance to, we've got several motel rooms. Was it the Roadway Inn in Albany? Is that set up and ready to go?
So that's the one thing, the one piece that we have in our back pocket, yes, is the Roadway in Albany, but we really need a local resource that isn't the best, specifically for the communicable disease team that needs to monitor those individuals, to have to do that and support those individuals in Albany and the neighboring community is not ideal. So we're continuing to try to identify local resources for that.
Okay.
Danielle and Charlie, are you really actively working at this point with your colleagues in both Lincoln and Lynn County, or has that expanded to a larger geography of close relationship at this point?
Specifically with Lynn County, we haven't worked much with Lincoln County geographically. That just poses a really significant barrier for support. But we are working with the city of Corvallis staff that have the oversight of the hotels, motels in the city limits to see what we can do to leverage those relationships.
And I wasn't speaking specifically to the isolation resources so much as just more broadly in terms of public health and the contact tracing and all of the messaging work that's going on.
Yeah, so we had 4 staff that we provided to Lincoln County as mutual aid. We have actually had to pull those back just right at the holiday. We were able to provide that support for almost 3 weeks, and the mutual aid's rotating around. More and more counties are making requests, and fewer counties have any available extra resources. People are leaning hard on OHA and their stable of flexible contact tracers, although when these very large incidents happen, like Union County, some in Washington County, it challenges the system statewide.
Thank you.
Charlie, on a side question, this is Annabelle again. I've noticed that there's an extremely heavy pollen count lately. Are you getting a lot of reports on questioning hay fever and things like that? I know that it's really come on strong with me.
Yeah, well, we're hearing that anecdotally. We have not, I've not heard directly, but I'm sure that is significantly challenging the medical providers as they, most medical providers, you may have experienced this even when you make an appointment for a routine physical or checkup or anything. You go through a pre-screening, and it includes coughing and sneezing and things like that. And the asthma season, hay fever season here really complicates things and makes it much more challenging for the medical providers, I'm sure.
Well, I guess I have a comment on the EOC operation, and I appreciate you folks being able to scale up as needed, and now when there's things are getting to be a little more routine, backing off and trying to right size the operation, but still keep the pieces in place, and that's encouraging. I guess one other question, haven't heard much about the TRACE program from OSU. I know their last sampling was in Lincoln County, and is there any kind of wrap-up results on that study?
Well, they're seeking funding for ongoing studies in our area and statewide and follow-ups to what they did in Lincoln County. I'm not sure of the status of any of those proposals to the donors who have supported that in the past or potential new donors, but I know that OSU is definitely seeking that funding, and in parallel, there's there's still the ongoing plan and the dedication of a significant amount of money for on-campus TRACE through the academic year, starting in the fall. But as far as community TRACE, I am not sure what the status of their funding support is right now.
Okay, thank you. All right, if there aren't any questions for these folks, next up is George Looney and financial update. And just a refresher, we used to when we had our Thursday board meetings, George would report then on the previous week, so we're, I think the information George has is a week and a half behind. Is that about right, George?
Yes, and even further. Without the meeting last week, I actually have 2 to present to you.
Okay.
Although, honestly, neither one of them are terribly remarkable. As Dave, Danielle, Charlie have all mentioned, with the EOC ramping down, expenses have been following along that line as well. Certainly our major expense for the EOC, as it has been from the beginning, has been personnel. So as the EOC starts to become less physical, the personnel costs have started to drop, and those costs are related to it. So really the significant things I'd like to point out over the last couple of weeks, we did have one charge that was over $3,000. That was for postage for the mailing that was done back in May. The postage kind of trailed a little bit, the bill for that, so we received that. And the other really significant and good news, it's a very small change on the spreadsheet, but on that grants tab, there's a little box there that says received yes or no, and the grant, the CARES Act money we did receive. So we've received the $1,015,000 that we requested. So that has come into the county, and we've received the funding for that. Beyond that, we did have another payroll that came through for the county, and we had to make about a $6,000 adjustment, almost $7,000 adjustment from our estimate to actual, which in reality is actually pretty darn good. You know, when we're trying to estimate what payroll expenses are for lots of moving parts, to come within that close is pretty good. So that means our folks are getting their paperwork in on time and doing the right things. So with that, this goes through the 26th, which the week of the 26th was kind of I worked 3 days. I know others were on and off. We had kind of a mix match of that. And then last Monday was our last physical day for the majority of us in the EOC. So I'm still tracking expenses through last week, although I expect them to be much, much more reduced than they have been in the past. So that's really a very brief presentation. There's just not a lot going on the finance side, which is good.
Well, I know Brian Lee had a lot to do with getting the, Form 214s filled out, and you may not be able to go home unless you fill out your form, kind of, and just getting that established in the beginning so it became routine and just part of what staff at the EOC did, and then makes your job possible to accurately trace. I think the county employees may have done a little better job in the beginning than the city folks, but they kind of caught up, and after several weeks, it sounded like things were being reported accurately as far as timesheets.
I think so, and I would say that those in the EOC really did a very good job. It's being out of the EOC that is difficult, and having even been gone for the last week, I understand the difficulty with it, because it's not something you think of in your normal job of, oh, I need to do this paperwork to get this submitted. It's just not the norm that we have dealt with, especially when you're doing work that is your normal job, but maybe there's a part of it that still needs to get reported. It's more of a challenge when you're off-site, but on-site we've done an excellent job, both city and county, of getting things done on time.
Well, maybe make copies of that $1 million check and put that where people are supposed to fill out their forms, and make sure people know there's a connection between filling out the form and getting at least some reimbursement.
I do have one
And,
follow-up.
and also, I was going to mention that I believe that when the state announced the CARES Act, that we should have another submission coming up this month where we will, because those costs were only cost through May 15th. So from May 15th on, we should have another reimbursement process that's coming up. It was originally projected for July, so we may see another check coming in sometime later.
Great. Zan?
Yes, this is.
Pat, I have another question.
Zan had a question.
Oh, okay, go ahead, Sam.
Thank you. I see in the list of grants and pending funding that the epidemiological investigations, diagnostic and consultative services, and all of that is still up in the air. I know that OHA has said that they will cover many of those costs and that we just need to be able to show them what we have expended. How is that going? And this may be more of a question for Charlie than for you, George. I don't know, because I know they were planning on using existing relationships and contractual relationships to make that happen.
I will enlist Charlie's help with it, because a lot of that's been being run through the health department, so I don't have a lot of knowledge with that. And we may have received some of that money. Sandy Smith was on vacation last week, so I wasn't able to get that updated before I had to send out the report. So I will be checking with her this week to see what the status is of those other fundings that they may have received while she was out.
So I apologize, Commissioner. I was distracted and just heard my name. So.
My question was about the relationship with OHA for reimbursement for epidemiological investigation, diagnostics, all of that. I know that OHA was saying that they had the money, no problem, you just had to ask for it, show your documentation. And how is that working?
Yeah, so we have not submitted, beginning to work with Danielle Summers, hopefully today, to start pulling together our first invoice on that. So there is a case rate, and it's going to be interesting to see how far that money goes from the state as numbers continue to climb. But we are going to begin invoicing that revenue right away.
Okay, and that was all, from what I understand, CARES Act dollars, and in theory, that all of those expenses for the counties were gonna be covered from some of those federal dollars. That was part of the reason they weren't releasing everything to smaller counties right away. So hopefully they have enough funding.
Yeah, you're correct. It is CARES Act, and so that is money on top of the base grants that we've gotten for public health infrastructure, personnel, testing, those kind of things.
Okay.
I have one other question, Charlie. This has to do with, there's been a lot of staff strain on staff and caring for them. And I'm a little bit concerned of how they're all going to hold up if we get a second strong surge of this stuff. And are we trying to schedule that in such a way so that staff are taking care of themselves during their free time?
Yeah, thanks for your concern, Commissioner. Yes, we are operating through the weekend now. We're on a 7-day schedule in the communicable disease program, skeleton staffing through the weekend, but we keep people there to meet our mandates, to do immediate follow-up on all case reports. So we've set up a rotation so people, are getting their time off. I have to say it is difficult for people to relax. It's difficult for us all in these circumstances when you're surrounded by the news, and not just COVID news, but other upsetting issues, and there's limited opportunities to get out and do the sort of recreation and breaks, and an awful lot of our staff have significant childcare and family challenges. So we're trying to be as flexible with time as possible, let people work early, late. We have staff that are working broken schedules and are taking, one day during the week and one day on the weekend to help do weekend coverage, and trying to be as flexible as possible, within our bargaining agreement limitations and our staffing needs, and be as responsive to staff as we possibly can be. But it's definitely wearing on us all and pretty daunting when we look ahead and can foresee this sort of pace and challenge, lasting months and months more.
Yeah.
Well, Dave Busby was filling in for Brian Lee, who's taking a few days off this week, so that was good to see. 'Cause,
Very well.
this is a marathon, maybe with short breaks as we go along. But any other financial questions for George? Well, thank you, George, and for keeping us up to date and giving us at least some good news. That's always helpful getting through our meetings. So we will undoubtedly talk to you next week.
Thank you. I'll talk to you next week.
And
Goodbye.
George, are you,
Yes.
after we close out the board meeting, hopefully in not too long from now, doing the service, or the report on the service districts?
I can be back for them. I'm actually in the middle of training for our new work order system, so I'm kind of bouncing back and forth. But I could definitely be back for the service districts.
Okay, maybe we can give you a heads-up call when it's getting close to that time, so you can take care of your other chores this morning.
Commissioner Miller, let
That would be good.
me just interject real quick. Jen is on the phone, Ambule with our finance department. Jen, is that something you were planning on taking care of, or is it actually George that's taking care of it? I just need to clarify, George, whether or not we need you back on the later or not.
Absolutely.
Hi, Joe and commissioners. This is Jen. I did not realize that there was anything for the service district today, so I don't even know what it's about.
So it looks like that's George's.
Sorry,
Yes,
George.
I'm not sure what it is either, so, but I will be here. I will certainly be available.
George and Jen, I'll step out here in just a little while and coordinate with you and or Mary.
Okay.
Okay.
Excellent.
Thank you. All right.
Okay, thank you all. I will talk to you either shortly or next week.
All right. Thank you. So I think that completes our EOC report. Next up is 5.2, face covering policy. That's, you're going to start that one off, Joe?
I will. Good morning, Commissioners. Coming before you this morning to ask for your consideration regarding the adoption of a resolution implementing a face covering requirement within our county facilities. Vance will help me with this agenda item this morning. I'll just provide you a little bit of context. You'll remember when we reopened county facilities the end of May, we instituted some guidelines and practices within the organization as it related to both social distancing as well as the topic of face coverings. So we have been practicing the use of face coverings within our facilities, also requiring customers to wear them as they enter our facilities as well. So keep in mind, we've been working with these type of things for about 6 weeks now. Last week, the governor instituted a face covering order throughout the state, which also obviously includes Benton County. And as a result of our previous guidelines that we were using when we reopened the county facilities, and now in addition to the governor's statewide order, Vance and I got together and decided we should bring a formal policy before the board as it relates to face coverings. And that's what we're bringing in front of you today. Vance and I have worked on this together. We've also solicited input from the sheriff's office as well as from folks within our community health center. I would like Charlie and Danielle to join in this conversation as they feel appropriate. But this is actually being brought to you as part of the work session meeting today. But also you have the ability, because this is a board meeting as well, to take action on this today if you're so inclined. What was in front of you this morning is a hard copy. Commissioner Jaramillo, I apologize you do not have this hard copy that identifies a few changes on the last page that I made last night and forwarded it to Vance for him to look at. So that's the copy I'm sharing with you today. I would like Vance to share some feedback that we received from several of our physicians within the community health centers that are not captured in the document that's in front of you today. So we would like you to consider adopting either the version that's in front of you or an amended version once we go through the discussion of deliberations. Vance, would you like to jump in?
So the one late comment came from Dr. Bradford. Dr. Bradford, I'd solicited input from she and Dr. Thompson, as well as from Charlie on the health side. The item that Dr. Bradford pointed out as perhaps not being as closely aligned with the emerging science on the topic of the spread of the coronavirus is item 3C. So Annabelle, that is on the second page. And I suppose for Pat and Zan too, it's on your second page as well. The general policy 3C talks about, I think, what we've been operating under for the last 4 months. If there's a 6 feet of physical separation between individuals within a workspace, within a confined area, that masks are not needed. Dr. Bradford pointed out that within a confined space, 6 feet may not be adequate to prevent the spread of the virus. And she is recommending that unless the person is alone in the workspace, perhaps it might be more prudent to require all persons within a confined space to have a face mask. And that was her comment. And I do want to emphasize that this is something that has come out in probably the last 10 or 12 days. Yeah. So this really is a rapidly changing resolution. I think just the fact that Dr. Bradford got this information to us yesterday is a good example. And just know that if you decide you're going to adopt this, it may well be that the health department comes back to Joe and or I in the near future and with new evidence and ask for perhaps additional tweaks to this policy. But right now, on July 7, 2020, this is, with Dr. Bradford's input, this is probably as up to date and as current as we have regarding the science on how to prevent the spread of the virus. So with that said, I would, if you're inclined to adopt this today, I would recommend that item C be changed to state that when staff are in their individual workstation and not alone, that they wear the mask. It might not be a bad idea to add a semicolon there that says, if alone, mask is not required, just to clarify that distinction.
Okay.
I think that sounds like a wise change to make in recognition of the fact that if anyone is going to be in an enclosed space for any length of time, they should be masked. They're with others.
Okay. Annabelle, did you have any comment?
One of the things that occurred.
No, Pat, I don't have any comments. I was just stretching.
Okay.
One of the questions that occurred to me as the recent news has arisen more about aerosol transmission of coronavirus is about our heating and cooling systems and just how effective our HVAC systems are and the filtration in our systems, and whether we, and Paul Walsinger in particular, is taking that into account as we make our upgrades and changes moving forward.
I can tell you I've had a number of conversations with Paul Walsinger over the last couple of months, especially as we were beginning to reopen our facilities. Paul did indicate that the filters that we utilize, and Charlie might be able to talk more specifically to this, were capable of capturing, if you will, or filtering out
Small particles.
small particles, that's a great way to put it. And so Paul did not have a concern, and he indicated that we were meeting a certain standard. I cannot cite what that standard is, but I'd be happy to follow up with Paul again and have him put together a quick paragraph for the board as an FYI, if you'd like that.
I think that would be a good idea, and a good idea for all staff as well. I'm sure I'm not alone in my interest and concern on that topic.
You bet.
I do want to emphasize one thing on this policy. It applies only to county-owned buildings. So it does not extend to businesses, it does not extend to the city of Corvallis. So just note that it applies to our buildings. Also, I want to emphasize that I have called out an exception within the county buildings, which is the courthouse. As you all are very much aware, the state courts manage their space, and we've given the state courts the opportunity to utilize this policy for their personnel or the state's policy as it relates to space occupied and operated by the state courts.
That's always been a little bit of a rough relationship there with the dual occupancy of that building. Yes.
Yeah. Kind of tough being in a position as a landlord with the state as your tenant.
Yes, and I have put that query out to other counties about how they're handling that relationship, but it sounds like we're doing okay at this point here. So
I would say we have open, ongoing dialogue.
that's great.
And actually, over the years, I think we've done a very good job with the state courts. It also helps that we have such a strong and close relationship with the three judges, which makes all the difference.
Yes. That's good. And I do see that the one change that was made yesterday evening was about the ADA accommodation process, giving the authority to Joe as county administrator or your designee to make judgments.
Actually, that's correct. There was really two changes embedded in Section 1 under Policy Administration. And the first part of that actually applies to the reasonable accommodation provisions, which is included in the face covering policy. I typically do not have any involvement in determining what a reasonable accommodation is. That resides within our HR department. So that will continue to reside within our HR department, and it was the intent of that change to articulate that I have the authority to make exceptions other than the reasonable accommodation component within HR.
Thank you for that clarification.
All right. Any other questions or comments?
Commissioners, if
I have a
you...
comment. Pat, what's the process now? I don't have any motions in front of me, but this is to amend our previous policy statement, or is it a break? Go ahead.
I have the meeting motion that's suggested on the checklist here. I would be happy to move to adopt resolution number R 2020-022, implementing a temporary face covering policy with the changes as made by County Council Crony and the red line version distributed by County Administrator Kirby this morning.
I will second that.
It's been moved and seconded. All in favor, say aye.
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 Motion for the resolution carries.
Commissioners, just so you know, the next steps will be I'll be working with Alyssa to create a communication out to employees within the organization. That's number one. Number two, tomorrow during our 9:30 update with directors, we'll be reviewing this as well. And then number three, Lori Starha, who has led the reopening of our county facilities, leads a group of social distancing officers from each building. You'll remember that the governor required that several months back. And so we do have a person representing each one of our county facilities that Lori meets with from time to time. So they will meet and review the policy as it's their responsibility to ensure, as well as others, that we're upholding these policy requirements.
Okay, well, just an example of how quickly things are moving. A week and a half ago, we passed the county ordinance requesting people use masks where appropriate. And then we got some responses from our constituents saying they would like that to be mandatory at the county level. And we were in the process of discussing that when about noon a week ago Monday, the governor makes it a statewide requirement. Before that, it was going to be, I think, 7 counties that were going to be in the mandatory category, and Clatsop County opted in to that group. Some commissioners took a fair amount of grief over that. And then Monday noon or early afternoon, the governor made it statewide, at least partially because of the increased percentages of positive results coming back from the testing. So I think it is accurate. Things move fairly quickly, and you think you've done a good job getting things down on paper, and it's a work in progress. So stay tuned. Okay, anything else on that? All right, 5.3, discussion of amending the 2019-21 biennial budget supplemental. Jen Ambiel. Take it away, Jen.
Good morning. How are you?
Good.
Good. I am back again with another supplemental budget, this time a small one. We do have one fund that requires amendment of the budget in the 1921 biennium. The action does trigger a local budget law requirement of a legal notice and public hearing prior to consideration because it moves contingency that is more than 10%. The tax, title, and land fund, we are asking for a reclassification of appropriation authority. Our request is to move $50,000 from the contingency line into trust operations, and that was due to an unanticipated cost of a fuel tank removal for the property over by the Bell Fountain gas station. So I am asking that we move this to the July 21st board meeting for a public hearing.
Okay. Are there any questions for Jen? All right, I would entertain a motion.
I would move to adopt Resolution R 2020-018 in the matter of supplemental budget 21011 to the, I have the wrong motion. I move to forward this item to the July 21st, 2020 board meeting as an agenda item.
All right. Do I hear a second? Okay. It's been moved and seconded. All in favor of forwarding this item to our July 21st meeting, say aye.
Aye.
Aye?
Aye.
All right.
I have two mice sitting here next to my hand, and I was moving the wrong one.
The hand signal was good, Annabelle.
Okay, good.
All right. Thanks, Jen.
Thank you.
Next up, item 6, our fairly lengthy consent calendar.
I would move approval of the consent calendar, except that I would like to withdraw the minutes from January 28, 2020. There are 2 or 3 corrections, and one of them I need to do some follow-up on with Erica.
Okay.
I'll second that.
It's been moved and seconded to approve the consent calendar with the exception of moving item 6.3 to a later date. All in favor, say aye.
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 The consent calendar is approved. Let's see, next up, item 7, new business. Discussion and decision to approve an order to participate in Solarize Corvallis. I don't see Paul, but I see Sean. Are you handling that one, Sean?
Paul's gonna do that. I think we did the dry run yesterday that we had planned on 10:15. I was just getting a little early that day.
Oh, okay.
I think that's with Paul. I know that he, Dan, Annette, and others are joining or trying to join. So I think just estimating Paul had indicated 10:15.
Okay, I think Joe may be out in the hall making a phone call to get Paul on board. So we will. We don't even have Muzak here. I'll hum for a few minutes and.
Well, respect, sir. I'm not going to be starting to hum or anything. So.
Okay. That may be a good thing, Sean.
We could take a
Very good, thanks, sir. Thank you.
5-minute break.
Okay.
Yes, and you can take the 8s, 8-1, 8-2. I don't know if Lindsay's on.
I don't see her.
Do you want to skip to 8.2?
Yep, let's get that out of the way. That's
Okay.
pretty routine. Let me go to that item.
So we're skipping ahead to item 8.2, second hearing, amending our county code, chapter 9, animal control. Vance Croney.
This is 2 weeks ago, you held a public hearing to adopt changes to the animal control chapter of our code. As you know, to change our county code requires adoption of an ordinance. County charter requires 2 readings. This is the second reading. It does not take place within a public hearing. It is simply a regular agenda item. So the second reading formalizes and finalizes the change to Chapter 9. The change becomes effective 30 days after the reading. I can't really draw this out any longer.
Do we, you will do the reading after we make our motion?
Yes, ma'am.
I move to enact ordinance number 2020-0298, amending Benton County Code, Chapter 9.
I will second that.
Okay, it's been moved and seconded. All in favor, say aye.
Aye.
Aye? Was that an aye, Annabelle?
Yes.
Okay.
That was a yawn. Who are you kidding?
It's a fine line, Vance.
It is good.
So,
After listening to you, Vance, I yawn a lot.
Would you like me to do the second reading, or do you want to do it?
go ahead.
That was an easy question, wasn't it? Okay, before the Board of Commissioners for the State of Oregon for the County of Benton in the matter of amending Chapter 9 of the Benton County Code, ordinance number 2020-0298. Now therefore, the Board of Commissioners of Benton County ordain as followed. 1, short title, this ordinance shall be known as Amendment to Benton County Code Chapter 9. And this will be effective 30 days from today. And on behalf of Erica O'Neill, thank you.
Okay. Okay, why don't we take a short, maybe less than 5-minute break, and hopefully Paul will be back with us at that point to handle 7.1. So we are on item 7.1, discussion and decision to approve an order to participate in solarized Corvallis. Paul Walsinger. Welcome, Paul.
Hi, can everybody get me? I was having a little trouble with my headset. Thank you.
You're on. Go ahead and we're ready for you, Paul.
Okay, I think we're just waiting for Dan with the Corvallis Power Corporation, or
Okay.
sorry, I mispronounced his organization there, but he should be getting on with us within the next couple of minutes. So, but in the meantime, I guess while we're waiting for Dan, I can sort of get started if you'd like me to.
Please.
Okay. We're here today to talk about what's sort of a new concept, which is a power purchase agreement. And just a kind of a little background history on this. We were really looking at how we could get the best bang for our buck out of our renewable budget for the building at 4500 Research Way. As you are all probably well aware, we're required to invest 1.5% of the total budget for any renewable project to renewable energy. And so Jennifer Brown and I were kind of kicking it around in my office one day, how we could really sort of get the best bang for our buck out of the budget that we had available. And so from that, we started looking at these power purchase agreements. And Jen was able to reach out to this local organization who who actually runs one of these power purchase agreements, which is, really in essence sort of a rent-to-own solar array system, so to speak, where an investor pays to build the array, and then we pay it back with the energy savings that we get from the solar array. So anyway, we sort of chased this around, and we ended up actually right back here in Corvallis with this really great opportunity to, have a community-ran and a community-invested program to run this. And so we're here in front of the board today to ask for two things. The first one would be direction or approval to continue with this power purchase agreement. And the second part of this would be then to entertain a sole source vendor authorization in order to continue with this process as well. And I'm trying to see on the screen if Dan has managed to make it yet. Annette, I see that you're with us.
Mm-hmm. Yes, I am here.
Okay. Are you prepared to kind of continue on with Dan and sort of present and discuss the program with the commissioners?
Well, I can wing it here. I thought Dan was going to make the presentation.
Well, I believe he is too. We're a little ahead of schedule here. Dan was supposed to pop on around 10:15, and so I would expect him to pop on any second. So,
right.
But if you could give us your...
Sure, I can talk a little bit about Solarize Corvallis, which is a partnership between the Corvallis Sustainability Coalition and the Oregon Clean Power Cooperative. And our purpose is to accelerate the transition to renewable energy from fossil fuels here in Corvallis as much as possible. And we're doing this by putting up large solar arrays and using community investment to help fund those solar arrays. And so far, we have done two, or have done one and are in the process of doing the second one. The first one was at the Corvallis School District office, a 150 kilowatt ground-mounted solar array. And the second one, which I hope is going up very soon. I see Peter Greenberg is on here, and Peter is the person doing the installation at Old Mill Center for Children and Families. And I believe we're waiting for just the approved permit from the city of Corvallis. But that's expected to go up very, very soon. And it looks like Dan is here. So maybe I don't know if he's signed on totally. And there he is.
Morning.
You're on.
Hi, Dan. Hey, sorry, we were just a little tiny bit ahead of schedule, so I've already been on and just sort of explained sort of the 30,000-foot view to everybody. But if you could just sort of address with the commission, the Oregon Clean Power Cooperative, what that is, and then sort of how we ended up where we are here today, I'd appreciate it.
Yeah, thanks, Paul. And I don't know what Annette may have covered, but the Oregon Clean Power Co-op is a member-owned cooperative that does what I call community-focused projects. So we've done solar for nonprofits, fire stations, local governments, churches, schools. We've done projects for the city of Hood River. Here in Corvallis, we put solar up on CHS. It's our first project here locally. And we've now launched into a initiative, a partnership with the Corvallis Sustainability Coalition we're calling Solarize Corvallis, with the goal of putting solar on as many non-residential roofs in town as possible. So our first project is, you may have seen it if you've driven down 35th Street lately, next to the school district office with 509J. And as I think Annette was just mentioning, we're just about to start construction on our second project at the Old Mill Center. And we're also talking with the school district about potential other projects. The unique ability that the co-op has is a securities exemption from the Oregon legislature that lets us technically take investment from non-accredited investors. So that means that we finance some of our projects' cost from everyday Oregonians. The minimum investment's $1,000, and we take those investments, we pay people back with interest, so it's not a donation. We aggregate those and we use that to finance part of the cost of construction. The other part typically comes from grants, from Energy Trust. In this case, the county, Paul, maybe you've talked about this already, the county has the 1.5% requirement, so that would also contribute. So maybe I should stop there and see if there are any questions. Okay.
I guess I do have questions about the financing aspect of this, but I'm not sure. I will wait until you've had a little bit more presentation, I suspect, from Paul about the overall agreement and framework.
Yeah, sure. Let me just get it up here. So you have, I think, the proposal in front of you, and why don't I run through that? And actually, maybe the place to start is if you want to flip down to, it's the third page, and there's a pie chart.
Yep.
So that's kind of the quick way to grasp the financing approach. So if people can see that.
Yep.
So there are 4 chunks of the financing, or pieces of financing stack. And this is pretty typical. This is actually exactly the same model we used with the school district, and very similar to the CHS project and other projects. So we start with the smallest chunk there. That's Energy Trust money, $20,000. It's essentially a grant. They call it an incentive. And everyone gets that if you have a solar project in Pacific Power territory or PG territory. You get that money. And we have, we've already reserved that, so that's all set. The next chunk is the community investment that I mentioned, community members. So we need $47,000 from that chunk, and we are fortunate to have essentially a waiting list from the Old Mill project. So we have that, essentially, we have that in hand. Usually what we do is we'll put the project together first, get all the approvals for it, and then we'll go out to the community and get the investment. But in this case, we could move forward this week if we wanted. The next piece is the tax credits. So you may know there are pretty substantial tax credits available for solar, federal tax credits. Those are going down. They went down the beginning of this year, and they'll go down beginning of next year. The county obviously doesn't pay those taxes, so can't take advantage of those tax credits. So what we've done is gone to a local business person and who can take the tax credits. And this is the exact same arrangement we did for the school district. So he will take the tax credits and in exchange put in $46,000. So he'll actually get more than that in value of the tax credits. So essentially everyone comes out ahead. And then the last piece is the $60,000, which the county is paying.
Okay.
So that's how we pay for it. That help?
That helps a lot. I was particularly confused about the community investment piece and the timetable for repayment of that and an annual payment of those community investments. Yeah. And I was confused by the description of it already being in hand and there being a 10-year repayment schedule.
Right. So the tax credits make us jump through all sorts of hoops, make things more complicated. And the way we set it up is we take the community investment and we lend it to the organization, so the county in this case. And then the county pays back the investors over 10 years, and we're sort of the conduit at that point. So the county will pay us technically the loans with the co-op, but we just take that money and essentially pass it on to the community investors.
So
we've started doing that with, yeah, go ahead.
So basically what happens is that we are paying back the investors plus their premium on that 10-year schedule. And they're loaning the project the money up front. Okay, now I understand it. Thank you.
Yeah, yeah. And now there's one more piece of the puzzle, which is how the tax investor fits in. So to take the tax credits, the tax investor has to own the project. And there's a bunch of different mechanisms you can use to do that. You can do an operating lease and so on. What we do is pretty industry standard, solar industry standard called a power purchase agreement, or PPA. If you know the OSU solar arrays on Campus Way Bike Path and so on, so that's the arrangement that they have with Solar City. They didn't pay for those up front. So the county would have a power purchase agreement with the tax investor, and that's also a 10-year term. But the way we set that up is it's prepaid. So typically, or more commonly, I should say, you're buying the power from whoever owns the system that is taking the tax credits, and you pay them every month or every quarter or something. What we do is we just pay that all up front. So the county is paying the loan back, but not paying anything on the PPA. So we take the money, lend it to the county pays that to the tax investor for the PPA, and then for 10 years you're all set. There is at the very end, there is a fair market value buyout. So if the county wants to take over the solar panels at that point, you can't just get them donated, and there's Treasury Department rules because why that's the case. That's going to be a pretty small amount, and if you look at the next two charts, projected energy savings or the solar cash flow estimate, you'll see that that's built in, and the estimate of that amount is built in into the savings estimates.
Okay, and so the definition of term was confusing to me too, because there were different terms referred to at different places in the document, but this is that 10-year term for the power purchasing agreement?
Yes, that's right. Yeah, we set everything up at 10 years, so the loan is over at 10 years and the PPA is over at 10 years.
Okay.
Well, it sounds like a great project, and I appreciate the kind of creativity putting this together and finding 3 other partners in addition to the county. You may have already said it. Do you have a timetable for installation?
Well, let's check with the expert on that, which is Peter. But I think we can do that very quickly, potentially within the next month. Typically, the slow part is collecting the community investment, but as I said, we've got that in hand. Peter, what do you think? And Peter, I'm sorry, did you get introduced? So Peter Greenberg from EnergyWise is going to be doing the installation work.
Briefly.
Peter has been struck dumb, it looks like.
There we go. Can you hear me now?
Yes.
I'm starting the Old Mill Center probably in a week. I'm just waiting for the permit. And it'll take a few weeks and then be ready to do your building, which is almost next door conveniently. If it gets real hot, we would switch over to your roof, since I don't want to be on a dark asphalt shingle roof when it's real hot. So in a month, and then it'll take a few weeks to do it the most. I just finished a system a little bigger than that went real well at the YMCA in Albany.
Great, thank you.
Okay. If the commissioners sort of have a better grasp and understanding of how the power purchase agreement works and the funding mechanism and everything, I'd like to just kind of, just sort of run over a few pros and cons of the program, if you'd like to hear those.
Yes, go ahead, Paul.
Okay. Well, the pros of the program are really in the fact that we get a much larger solar array for our initial investment. And the cons that sort of come off that are not really all that conish. There's really not a huge financial gain. The money that the money outlay that we're putting out versus what we're not paying in electric bills on the other side is pretty much a wash. There's a couple of factors that are coming along. One of them is the closing of the Boardman coal-fired plant, which does provide a fair amount of energy to our area, and we are probably going to look at a significant kilowatt-hour increase when that happens, which makes this program much more viable at that point. Really, the only lose side that I see to this program is if the Montana volcano erupts and we go into 6 years of darkness is, really the only thing that stops it from being a viable program. But as far as money goes, it really turns out to be a bit of a wash for us. But any other questions on that I can answer for you?
Well, you're saying the financial is a wash until power rates go up significantly, and those aren't built into your model. Is that correct?
Indeed, and it would be my intention to run this program through about the 10-year point and then look at purchasing the solar array at that point. This is about 50% of the amount of power that we can fit onto the roof of 4,500. At that point, we'll have a lot better sense of where we're at with the tenant and how the building's actually operating. Currently, the building uses an incredible amount of power. We're like 127,000 kilowatt hours per month, or right in the neighborhood of about $10,000 per month in electric. Most of that electricity is being used by the servers, by the enormous server racks that the tenant has in place. So as that begins to phase out, the total energy reduction in this building will go way down. And it's really my hope that between the room that we have on the roof and maybe a little bit of property room we have for some extra array, we can get this building pretty close to net zero over maybe the next 10 or 12 years, somewhere in that neighborhood. So it would be my intention to purchase the solar array probably around the 10 or 12 year mark.
Great. That really helps kind of fill in, make sense out of some of the numbers I'd forgotten. in the rooms that we can't get into, what's going on there and how much power is being used. So that's kind of helpful background information.
I do have another question, and that is, I believe that it states in the agreement that the owner's responsible for all of the operations and maintenance for the first 5 years, and then after that, it reverts to the county to do that. And I wanted to know what the annual cost typically is for that maintenance.
Yeah, good question. So all the materials are covered under warranties for 10 years or more. There's also a performance guarantee on the solar panels, and that typically has been, the industry standard has been 25 years, 80% of the initial production, electrical production, after 25 years. Solar panels are now becoming a commodity, and that is becoming extended. So I think the panels that we're looking at, Peter can correct me, actually have a 30-year performance guarantee and higher than 80%. So this stuff now is all pretty much commodity equipment. The solar panels have no moving parts. They're very reliable. If something does fail, it typically is right up front in the first few months or year. So what we do, everything, as I said, is covered by warranties. And then on top of that, we layer 5 years of annual on-site inspections. So if you look at the cash flow, there's I forget the exact amount, but something built in for that. So that's just kind of double, double coverage, if you will. The one piece that does need to be replaced is the electronics in what they call the inverter. Mm-hmm. Those nowadays have a lifetime typically of 12 to 15 years. So what we do is, if you look at a cash flow in year 15, there's a bump of about $2,500. That's our estimate of what it'll cost to replace the inverters at that point. It's basically a placeholder. We don't know 15 years from now what it's going to cost, but we want to put something in the cash flow to show that that expense is the one expected expense.
And then there would be some annual cleaning. I mean, the solar panels do get dirty, and they don't perform quite as well when they're covered in dust and pollen, but I'm assuming that's not very expensive.
Well, that's a good question. So you get different opinions about whether how much you lose from dirt, and we have plenty of rain in Oregon, so they typically get wiped off pretty quickly. Peter, do you want to weigh in on that?
We own about 160 solar systems and clean most of them every year. I have a high-powered brush that spins with high-pressure water pressure. We just use water to clean them. Takes it's real quick. With the lower pitch angles, it's gonna be 10 degrees. I clean them once a year. The simplest way is go up in the rain with a very soft broom and rinse them off. The bottom edge just gets a little dirty. Mm-hmm. But I'd throw in for the first 3 years, we'll clean them. And along with that, I'll also monitor them. I monitor almost all our solar systems daily. So if something goes wrong, we'll know before anybody else.
Yeah.
But it's not a big deal to clean them.
Thank you.
Yeah, thanks for mentioning the monitoring. So I don't think we covered that. So as Peter said, we'll be keeping track of receiving alerts if any production falls off. And nowadays, this is all web-based, so you can look at it on your phone. Any of us can look at it on our phones, and we can put it up in the lobby of the building. So as you come in, you can see what the solar is producing.
Thank you. That sounds great.
That was one of my questions. What kind of PR or it looked like the panels wouldn't be very visible from the road. And just is part of the installation something that our citizens can see?
yeah, as you said, you can't see them from the road. So we'd like to do, we'd like to do a press splash. We had plans to do that for the array at the school district, and the timing was just a perfect storm. It was right as the pandemic was taking hold, so we didn't do anything there. So yeah, we would like to to do a press release and put it out in county newsletters or whatever. And then the city of Corvallis, I don't know if you've been on their website, but they have all of their solar systems on one page, and you can look at all of them and see the production. So we'd like to do the same if the county is willing on your website.
We would like that.
Yeah. I mean, it's one thing to physically do the project, but letting people know what we're doing, especially on an ongoing basis, how the system's performing, how much power it's producing versus how much we're using, and just some of those kind of basic metrics would be nice to be able to spread around and let people know what we're doing. And all right, so I'm glad that's part of the project.
Yeah, and from a facilities point of view, that's really part of a much larger project. We now have capability to read solar panel production at the Health Services Building.
Good.
Now the upcoming Lincoln Clinic, that system is designed the same way so that we can monitor production off of it. And then here at 4500, so we're not very far from being able to start to combine all of those into one place where we can put it up on a display board and really display what what kind of energy we're producing as a county, through these renewable energy sources.
Well, and that fits into, this is phase one for this building. This is what it's doing, and some years down the road, be able to either add on the roof or on the ground more panels to get to our goal of a net zero building.
Absolutely, Commissioner Malone. I think that's really the goal here is, after a few years, I think we'll really have a pretty clean picture of how much energy we're using in the building, along with other technology. And then we'll know for sure at that point how large of an array we'll have to build in order to sort of hit that net zero. So we just need a couple years of data to get us to the right place.
Great. Any other questions? Did you have anything, Annabelle? Okay. Let's see.
Are you ready for a motion?
I'm ready.
I would move to approve the order authorizing the use of a sole source exemption to the process as described in Benton County Code 2.275 to contract with Oregon Clean Power Cooperative for the solar project at 4500 Southwest Research Way.
Second.
It's been moved and seconded. All in favor, say aye.
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 Right. Well, I'm glad this isn't way off in the future, and be able to be in business this summer. So keep us posted.
And I wanted to comment that I like Peter's Old Mill Center t-shirt. Noticed that you were wearing it for the occasion.
Paul Walsinger, if you'll also stay on the meeting for a few moments to have a follow-up discussion with the board on the other topic I mentioned to you.
Yes, sir, I will. And Dan, Peter, and Annette, thank you very much for all of your efforts to get us through here till today, because the commission doesn't see the 7 million emails that went back and forth to get us to this point. So thank you very much.
Thank you very much. Appreciate it.
Did you happen to end up with a stack of actual physical papers about 3 inches high?
Yeah, project by the pound, if you will.
Thank you.
We're looking forward to getting it built quickly and having a celebration. Hopefully not virtual, but we'll see.
Outdoors. It'll be outdoors.
Yeah.
Sounds good.
Well, thank you, Paul and Jen, Sean, and team.
Thank you.
All right. Bye, everyone.
Bye. Thank you, Dan.
Bye.
Erica, just a point of clarification, the Benton County Code reference is actually 2.725, not 2.275.
7.5? Okay, thank you, guys.
2.725. There's a lot of twos in
A
there.
little dyslexic there.
2.725. Okay, thank you very much.
Yep.
Are you referencing old business 8.1? No.
Oh, no, the number was different in the staff recommendation than it was in the meeting motion, and the one in the meeting motion was incorrect.
Yep.
Okay. Great. Thanks for catching that.
Commissioners, before we move on, I'd just like Paul Walsinger to address the question relative to filtration in our buildings. Paul, this is in reference to our face covering resolution the board just passed earlier this morning. The question was relative to our HVAC equipment and what it does and does not do relative to filtration.
Sure, difficult question at best, because every building has sort of a different, heating, air conditioning, and ventilation system built into it. The Sunset building, we'll just use as sort of a classic example. We have 7 heat pump units inside that building that operated, and then 4 or 5 ductless units that, where the compressor's outside, it just makes heat or cold on the inside. Each one of the units is equipped with a filtration system, and the amount of filtration that we can put to the system is really dictated by the size of the unit. HVAC systems, there's a pressure differential on either side of the filter, so where the air is circulated back through, and it's in this really weird, monitoring system called inches of water column. And so basically we're looking for a pressure differential of about 6 inches per water column. And if you raise that to just 7.5 inches of water column, it makes these newer units almost 50% less efficient because they're not moving as much air through them. So putting heavier and heavier and heavier filters or thicker filters in the units drives the efficiency down dramatically. Each unit is sort of set with its own place where you can put a filter in it, and so the thickness of the filter really determines how it filters through, and that's determined by a MERV standard. Standard for commercial buildings is MERV 7. The improvement to that is MERV 8, and it goes all the way up to a MERV 20 filter, but that's nearly a gas mask respirator at that point. So most of the filters we're using in the county are between MERV 7 and MERV 9. And we're using as high a quality filter in each one of these systems as it will accommodate. There's a couple of things that kind of run to our advantage as far as the COVID virus goes through our filtration system. There was a lot of trouble on the cruise ships, and there was a lot of COVID that was spread through their air filtration system because they work a lot differently than we do in a building. In a ship, they basically suck air in one side, they blow it all the way through like a mine shaft, and it evacuates on the other side. So there's the ability for that air to transfer sort of from cabin to cabin to cabin. We're in a building that doesn't really work necessarily that way. The air is sucked up through a return, some sort of return vent, taken to the unit, processed where it's either heated or cooled, ran through a fan, and then returned through a ducting system through the building. And so if I try and picture just that small water droplet where somebody coughed or sneezed or whatever the case may be, and how that would travel through that system. And so it would have to find its way to that air intake to start with. It would have to get pulled into that ducting system where it has to travel through. And, thankfully, a little bit of fuzz and lint and this sort of stuff builds up on the inside of these ducting systems, which almost acts in a filter in its own way. If that water droplet hits that fuzz, so to speak, anywhere along the way, it's going to stick, hold there, and just die a natural death until it makes it all the way up to the unit where it's going to meet the filtration system. And like I said, we use MERV-rated pleated filters, and we use the highest rated filters we can for the system that's in place, and then the air is then recycled back out to the spaces again. So that's the basic to it. If we want to upgrade that system, it starts becoming difficult. UV light is an option. I kind of dug into those already a little bit to see if it was even going to be feasible for us, and it's going to be, more than $20,000 a unit, and more importantly, they're just not available. The hospitals, medical facilities, government facilities are eating all of those units up faster than they can come off of the production line. And other than, we can site build in some heavier filter systems where we can put larger filters in there, and that will work as well, but it's going to decrease the efficiency of the units pretty dramatically if we expand the size of the filters that go in there. And then really lastly, the Kobayashi Maru, if you will, the last choice would be to literally shut the units off and stop that flow of air.
Okay. Thank you. That's very helpful. And I guess this is an example of where having multiple systems in one building can actually be useful because we're segmented and we're not filtering all the air through one system, as you say, in a cruise ship. So I'm grateful to hear that. I guess my interest would be that if in meeting rooms or public meeting rooms, if we're investing in any public meeting spaces, that's where I would look to potentially deploy some sort of a UV light unit if we had the opportunity to do so. So just thinking ahead to some of that potential new construction or any meeting room upgrades.
I can start beating the streets and see what I can come up with for UV systems there, because as the pandemic continues, more and more people are, of course, seeing a profit opportunity here, and so production is going up on these units. So we can beat the street and see if we can find some of these units. I think they'll be effective against the virus, and probably even more so, as just some sort of a visual piece that people can see that there's an effort being made.
Yeah.
Well, Paul, I haven't heard the term inches of water column for decades. I did ceramics, and that was how we measured the gas pressure. So we'll have to chat and make sure I still understand what that means.
I'm not perfectly sure I understand what it means.
It's a way of measuring low pressure.
Yes.
But it's an old system.
Well, now the building monitoring systems are becoming so sophisticated. They're actually putting pressure readers on either side of the filter units, and the filter runs until it reaches a certain pressure differential, and then you get a warning that it's time to change that filter. Rather than changing them quarterly, which we do now, you don't change filters until they're actually ready to be changed based on the pressure differential.
That's great.
Well, I appreciate the background information, and that may come into play on 4500 Research Way and what that building is currently set up as, and if we're doing any changes there. But so thank you.
You're welcome.
Thank you, Paul. That's helpful.
All right.
Thank you. Am I off the hook now, Joe?
Yes, thank you.
Thanks, Paul.
All right, thank you very much. All right, have a great day.
You too. If I'm back on track here, 8.1, second hearing, amending of Benton County Development Code, chapters 53, 55, 60, 91, 94.
Commissioner Malone, I believe Vance will take this item. I
Oh.
don't see Lindsay on
Okay,
the call at this point.
Yeah, so this is just the companion item to Chapter 9. You held the public hearing, first reading of these various code amendments 2 weeks ago. Before you is the opportunity to conduct the second reading of the ordinance. And again, it goes into effect 30 days from now. One of the things that I just want to bring to your attention is that I had a conversation with Lindsay yesterday. Lindsay asked, apparently, and I didn't ask which section that is being amended she was referring to, so don't ask me the number. She asked if she could add an language to the ordinance. And I told her, no, today you can't because there's no public hearing involved. Remember, second reading doesn't require a public hearing. So she and I discussed coming back at a future date with just that adjustment or rolling it into another series of code amendments that the planning department is going to bring forward at some time. She said that there is a difference between state administrative rule and state statute, and that as she did her research around the state, she said some counties do have the language that is put forward in the statute. Others have language that is put forward in the administrative rules. When DLCD reviewed the proposed changes, at least 45 days ago, they had no comment, so clearly they didn't mind the presentation. Lindsay feels that and again, I'm not certain whether she's referring to the statutory language or the OAR language. She says that the one that she did not include would make things clearer for the planning department, which clearer is better because obviously if it's clearer for the planning department, it's clearer for any applicant who's come forward. So just know that there was an adjustment she caught later on that is not included and will not be included until there's another ordinance put forward to change anything else in development code.
okay.
So,
With that,
do you really want me to talk anymore? Annabelle? No, Lord, no.
with that, I would move to adopt ordinance 2020-0297, approving the Benton County Development Code amendments to chapters 53, 55, 60, 91, and 94.
Second.
All in favor of adopting the ordinance, say aye.
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 Motion carries.
All right, second reading.
Take it away, Vance.
Before the Board of Commissioners for the State of Oregon for the County of Benton in the matter of amending the Benton County Development Code, Chapters 53, 55, 60, 91, and 94. Ordinance number 2020-0297. Now therefore, the Board of County Commissioners of Benton County ordains as follows. Part 1, short title, Amendments to the Benton County Development Code, Chapters 53, 55, 60, 91, and 94. That's the end of the second reading. These changes will go into effect 30 days from now, which is what? It's going to be August 6th, isn't it? 31 days in July?
Yep.
Yeah,
March, April,
exactly.
May, June, July. Yeah,
Yeah,
it still
31
works.
All right. I think that takes care of 8.1. Is there any other business we should consider at this time? Hearing none, I will close out our board meeting. Yep.
Hi, this is Teresa, Commissioner Malone.
Yes.
And I was going to let you know that I have been in contact with Debbie Wine, and Gary Stockhoff was supposed to present the CSDs. He is out of town. So Debbie said that she would step in if George Looney was not able to link in. So she should be calling in or linking in here in just a moment.
Okay,
Teresa, hey, Joe Kirby. Also, I had a conversation with Mary Otley, and she's making herself available for them as well.
Right. Okay. Good.
we'll just, as long as we're waiting this, well, we can close out the board meeting, is that correct? Okay, and next up is the 3 service districts, and the order is Alpine, LC, and South Third.